Hi, in this video, I want to talk about awareness of breath and how it complements controlled breathing. Controlled breathing is an absolutely fantastic tool that allows an individual to go out and down-regulate their emotions in a really quick and simple way. We use this quite often with panic attacks in particular, and it's proven that it's very effective, and I personally use it very often with my clients. What I do like to do, however, is to bring in a component of an awareness of breath rather than just controlled breathing in and of itself. Controlled breathing can sometimes be used and certainly learnt by clients to try and remove a situation of angst, in particular panic attacks. So if we use panic attacks as a common denominator for this video, it'll be quite useful so I can demonstrate how we would use this awareness of breath. So panic attack comes along, and the normal course of events is someone goes out and they learn controlled breathing, and they sit down, they try and breathe their way out of this panic attack. And in actual fact, what they're trying to do is get rid of the panic attack. And all they're doing is they're focusing on all the discomforts that are occurring, and they're trying to get rid of it. The more they focus on those things, the harder it is for them to down-regulate. Even though controlled breathing is fantastic and it does do some down-regulation, there's a tendency to go out and attach to our heart racing, feeling suffocated, our chest pushing towards us, feeling movement in our stomach, being sweaty, tension in our muscles, and so on. So having an awareness of breath is really important to add to the controlled breathing. So when I do this exercise, when I teach this exercise with my clients, there are three fundamental places of awareness in the present moment that we're trying to promote. So the breath consists of three sections or three phases. We have the inhale, we have a pause, and then we have an exhale. And what we're wanting to look at in this is how we being aware of the breath in each of these components. Simply breathing is not enough. We want to add that. We want to make that more robust for our clients. We want to make that something that they're able to use, not just to try and get rid of these feelings, but also get them centered, get them grounded in the here and the now. And so that grounding experience is much more important. And there's no better way to do some grounding than to stop in the present moment. And that happens with awareness. So the inhale, we want to go out and breathe through our nose. And that's important because it doesn't go out and suck it all in at once. If I breathe through my mouth, I go, oh, it's all done. If I breathe through my nose, I go, it's a nice deep breath. I use my abdomen, so my abdomen pushes out, and I want to be aware of my abdomen moving. So when I take a deep breath, my abdomen goes, comes back in. So it goes out on the in-breath. So I look at my stomach. And that's quite important. And in actual fact, I look to have my shoulders push back, because if I crouch over, it's hard. I end up crushing my abdomen area, and I start putting pressure on my lungs as well. So I want to look at my posture. As you can see, what I'm directing my client to do is actually to watch their breath come in through their nose, to watch the stomach move, and to make sure that they go out and put their shoulders back. So it's quite important that we go out and do this. The pause is a holding period. And just to give our client an opportunity to go out and be aware of this pause, I ask them to count to 1. So it's just 0, 1. It's just a very, very soft pause. And so we hold, nothing's occurring at this point. It's actually being in the present moment. We're holding 0 to 1, and then we've got our exhale. And the exhale is extremely important. What we're trying to focus on is breathing out for as long as possible. So it would look like this. And there it's gone. So it's quite a long out breath. It's through the mouth. And once again, the client can focus on these things. It's long in nature. And what's important is our stomach will go out and move back. So it's mouth, it's long, and we watch our stomach. So it goes down and it breaks it up so that we've got these different components so that we can watch them, we can observe them, we're aware of the breath. If someone's able to hold more awareness, then we might start asking to notice the temperature when they're breathing in of the air, and that it's warmer when it's coming out. And you can just put your hand up and you can notice it on your hand. What we're doing is we're bringing in the here and the now. It's a grounding exercise. Breathing will down-regulate. Feeling temperature on your hand will ground you in your hand. Watching our stomach move grounds us in the stomach rather than my heart racing, rather than getting consumed with the sweating that might be occurring, rather than the pressure on my chest. I'm simply watching the breath. And what's nice is the breath does not go out and stop. It continues to move. We would practice this in session so that the client can feel grounded, and then we would ask them to stop and take notice of how they're feeling in that moment so that they can actually ground and then become present about the present moment. They can actually notice them feeling calmer, them down-regulated. So it's very important where we're doing awareness of breath. It complements that simple controlled breathing. It's adding to that. It's making it much more robust because it's a grounding exercise. There is a little bit of a first aid strategy or some tips that I ask my clients to do. They can either do it sitting down or standing up, but that is the first part of the first aid. So step one is to sit down or to stand up, but I ask them to put their shoulders out so they're not restricting themselves. So usually standing is quite useful. So that's step one. Step two is to start to take these deep breaths. So they're taking the deep breath while they're noticing these things. If they can, to take to have a water with them, or to get a glass of water or a bottle of water and to sip a little bit of water. That's grounding. They're sipping water. They can feel that. Cold water is quite useful because it brings us to the here and the now, the coolness in the mouth, the coolness running down our esophagus into our stomach. It all cools us and it's very, it draws us into that experience. So that's three. And there are times when it's useful to notice things in the room. That would happen after some of the controlled breathings occurred, but then to just begin to notice some things in the room. And that can be what they can see. So they might say, I can see a chair, I can see a table, I can see clouds, I can see my nail, and so on. I can hear cars, I can hear someone talking to somebody else, and so on. So we go back into those present moment sensationary experiences, and the sensation of breathing, moving out in the stomach, and so on. Very grounding, so very useful. So awareness of the breath, put that together with controlled breathing, and it becomes much more robust than just controlled breathing, which tends to feel like an avoidance mechanism rather than stopping, dropping anchor, being in the here and the now.